Hello, and welcome to Spurbs Herbs, episode 106. Today we are going to be talking about Xiao Qing Long Tang Minor Bluegreen Dragon Decoction. So let's get into it. Today we'll explore another Chinese herbal formula, Xiao Qing Long Tang or Minor Bluegreen Dragon Decoction. I gotta say this is one of my favorite decoctions or formulas, more because of the name. It's cool, it's got dragon in it. Rather than, I've definitely used it, but not that often. But we're going to get into that. This formula is in the subcategory of formulas that release exterior wind cold and is especially good at treating copious mucus. We're going to do our usual deep dive into this formula and find out if there is any evidence or concerns. Today, we do have an extra long episode, so we're going to skip to something a little different, which we do now and again. But it is going to be another scintillating discussion of herbs, so please stay tuned and join us. Before we get going, I just want to let you know that we have an amazing special going on right now for our courses. If you use them for continuing education, professional development, or just for your own edification, we are offering 50 hours of courses for an unbelievable price. Normally, this would cost $750, but with the special code 50 CEUs, that's 50 CEUS, this is going to be only $325 or less than half of what they normally would at only $650 per hour. Plus, you can get a free signed copy of one of my books. Just pay for shipping and handling. That is a free copy of Integrative Pharmacology, combining modern pharmacology with integrative medicine, or playing the game, a step-by-step approach to accepting insurance as an acupuncturist. Just go to the page, www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org/CEUS1, CEUS1 for this amazing deal. That's www.integrativemedicinecouncil.org/CEUS1, and you can get that amazing deal. We've never done a deal this good. So today's formula is Xiao. Let's do the Talmud. Xiao Qing Long Tang Minor Bluegreen Dragon Decoction. Of course, I just spoke Chinese, and as I usually say when I speak Chinese, that I've had several years of Chinese. I still suck at pronunciation, so I apologize for it. I think I'm better than average and not very good in general, so those trying to learn. So the name of this formula is thought to be derived from ancient Chinese symbolic associations. The wood spirit from the east, known as the blue-green dragon, is present in the billowing ocean waves and is responsible for generating clouds and for stimulating them to produce rain. Major blue-green dragon decoction, remember this is minor blue-green dragon decoction, but major blue-green dragon decoction produces sweating like the dragon produces rain. It is one of the strongest diaphoretic sweating formulas in discussion of cold damage and is thus referred to as major. Minor blue-green dragon decoction, Xiao Qing Long Tang, transforms thin mucus and expels pathogenic influences, much like the dragon manifests in the power of the waves. Its effect on the qi and fluids is milder, hence it is referred to as minor. There you go. That's the reason for the names. Other names for this formula include Xiao Qing Long Tang. Now that sounds exactly the same, and it should. It's just spelled differently because it's Wei Giles. Instead of XIAO, it's HSIAO. Instead of QING, it's CHING. Instead of LONG, it's LUNG. These are all Wei Giles things. And if you're not familiar with Wei Giles versus pinyin, pinyin is now the standard way to translate Chinese characters and pronunciations into Latinized letters. That's the letters we're used to. And so that pinyin is now official everywhere. As far as I know, it was China, and up until about 15 years ago, Taiwan was on Wei Giles. And so they were not pinyin, but they did change over to pinyin. So now pinyin is kind of the universal way to do this. But Wei Jiao still hangs out a lot, and it's just a different way of doing it. There's another major way, which is Yale, which is you'll see in some scholarly works more than anything else, older scholarly works. But there's still a lot of Wei Jiaos that's still around. But so there you go. It's also known as Xiao Qing Long Tang with a C. This is a mixture. I don't even know where that is. There's an X in the Xiao, but it keeps the CH instead of the Q, and it still has the LO. I don't even know where that came from. Minor Bluegreen Dragon Decoction, of course, we know. Minor Blue Dragon Combination is another name as well. So it's Minor Blue Dragon Decoction and Minor Blue Dragon Combination. So it kind of gets rid of the green aspect of it. This formula is in the subcategory of formulas that release exterior wind under the category of formulas that release the exterior. This is according to one of our two usual formulas textbooks. That's Scheid and his team. Our other usual formulas textbook, Chinese Medical Herbal Formulas and Applications, Pharmacological Effects and Clinical Research by Chen and Chen, says it is in the acrid and warm exterior releasing formulas subcategory under the exterior releasing formulas category. So slightly different. So they kind of look at one looks at what it's doing and one looks at what it's causing, but they're basically the same. Slightly different translations. Let's talk about these categories. As we discussed in several previous episodes, Scheid et al. Describes the overall category in detail, and we've done that many times at this point. However, having gone over it so much, today let's discuss what Chen and Chen says about this category and subcategory. So we haven't done that yet, so this is all new. And here's what Chen and Chen say. Exterior releasing formulas induce perspiration, release exterior factors from the skin and muscles, and or promote the eruption of measles. This method of treatment is known as Han Fa, sweating, one of the Ba Fa or 8 treatment methods described in the Huangdi Neijing, or the Yellow Emperor's Inner Classic, written in the 1st or 2nd century AD. So I would actually usually say that's BCE rather than CE, AD. Remember, C is the more updated version of AD. So I've always heard it's about 2nd century BCE, but there's differences of opinion. The term exterior syndrome, hang on, what's going on here? There we go. The term exterior syndrome refers to the invasion at superficial parts of the body by one or more of the Liu Yin, 6 exogenous factors, namely wind, cold, summer heat, dampness, dryness, and fire. These 6 exogenous factors attack superficial areas of the body via the skin, mouth, or nose. This causes a number of exterior signs and symptoms, such as aversion to cold, fever, headache, muscle aches, a thin white or yellow tongue coating, and a superficial pulse. While most exterior releasing formulas are indicated for either wind cold or wind heat syndromes, they also treat other disorders such as abscesses and sores, edema, dysentery or malaria, measles, and the early stages of Wenbing worm disease. So this Wenbing worm disease is an interesting one. It's a later development in Chinese medical history, but it is a school of thought. So the school of thought that this comes from, because we're going to find out that it comes from the Shanghai Lung, is what's known as the cold school, or we think that what happens is cold pathogens enter the body, and it describes how to enter the body. So this is through the 6 stages is usually what it's called. When Bing School says, and that was written 1,500 years after the Zhang Jing established the cold school, Wen Bing says, well, what happens if instead of a cold pathogen entering the body, a warm pathogen enters the body? And that's a whole different sort of approach to this. It sounds interesting. And why would there be 1,500 years before this? But there's a lot of historical reasons for it, which we're not going to get into today, but just want to explain one big real quick. At this early stage of illness, going back to Chen, at this early stage of illness, which the disease factor is located at the exterior, the treatment plan should focus on expelling the disease factor from the skin and muscle levels. The exterior releasing method is the most appropriate method for achieving this goal. If the Liu Yin 6 exogenous factors are not released from the exterior, they may proceed inward to attack the Zong or solid and Fu hollow organs, which leads to more serious illness. Thus, treat exterior conditions immediately with exterior releasing formulas to prevent complications and deterioration. Chen continue with cautions and contraindications. Exterior releasing formulas are generally taken as warm decoctions to induce perspiration. Mild perspiration over the whole body is ideal. The body may be covered with a blanket to ensure and facilitate perspiration. However, profuse sweating should be avoided since it may deplete qi and yin and in severe cases cause qi or yang collapse. After taking the decoction, avoid exposure to wind to prevent recurrent attacks. Avoid foods that are raw, cold, oily, or greasy, as they may decrease absorption and compromise the therapeutic effects of these formulas. If interior symptoms are observed along with exterior symptoms, the normal treatment plan is to treat the exterior first, then the interior condition second, or treat both interior and exterior conditions at the same time. In other words, don't treat the interior before the exterior. Exterior releasing formulas are contraindicated if the disease factor has fully progressed into the interior. These formulas are also contraindicated in the presence of ulcerated sores, erupted measles, deficiency type edema, and dehydration from vomiting or diarrhea. Chen then discussed the subcategory of acrid and warm exterior releasing formulas. These formulas treat exterior wind-cold syndromes. Common symptoms when wind and cold invade include aversion to cold, fever, headache, neck and or shoulder stiffness, soreness and pain of the muscles and extremities, the absence of thirst, no perspiration or fever and aversion to cold that persist after perspiration, a thin white tongue coating, and a superficial tight or superficial moderate pulse. Superficial being key component there to the pulse. So what does this do? What does this formula do? It's Chinese medical actions. Scheid and his team say this formula releases the exterior, transforms thin mucus, warms the lungs, and directs rebellious qi downward. While Chen say it releases the exterior and dispels yin, invisible phlegm, and relieves wheezing and coughing. So this idea of invisible phlegm is interesting. In Chinese medicine, we have what's known as substantial phlegm and insubstantial phlegm, or invisible phlegm. And both have the same sort of symptoms, but some are visible, like you'd imagine you cough it up, that's visible phlegm. But this is saying it's invisible phlegm. It's in your chest, it's not coming up, it's there, it's causing problems, but it doesn't have you can't see it. So what are the Chinese medical indications? So that's the actions. What are we actually going to be using this on? So Scheid and his team say this formula can be used for fever and chills, with chills predominant, without sweating, cough, wheezing, sputum that is copious, white, stringy, and difficult to expectorate, stifling sensation in the chest, generalized sensation of heaviness and body aches, no particular thirst, moist tongue coating, and a floating tight pulse. In severe cases, there may be a floating edema or considerable difficulty in breathing when lying down. From an organ systems perspective, chronic water metabolism problems and thin mucus are associated with a disposition toward weakness of the lungs, spleen, or kidneys, of course in Chinese medical terms. When such persons contract external wind cold, these problems are further exacerbated by closure of the interstices and pores at the surface. Wind cold fettering the exterior hinders the protective yang qi and constrains the nutritive yin qi, resulting in fever and chills without sweating. The lungs control the qi in the exterior and facilitate flow in the water pathways. When lung qi is constrained by wind cold, the qi mechanism is further impeded. Then mucus readily attacks the lungs from the epigastric area, where it accumulates due to a failure of the spleen's transportive and transformative functions. We call that spleen's T&T, transportive and transformative functions. This process leads to coughing and wheezing with copious white stringy sputum that is difficult to expectorate, a stifling sensation in the chest, and in very severe cases, difficulty in breathing while lying down. Fluids entering the superficial levels of the body can cause floating edema, a generalized sensation of heaviness and body aches. Thin mucus accumulating in the stomach prevents its qi from directing downward, leading to dry retching. The absence of thirst and the moist tongue coating indicate a surfeit of fluids. The floating nature of the pulse indicates an exterior condition, while tightness reflects the presence of cold. Still in Chinese medical indications, Chen and Chen say, wind cold at the exterior with water accumulation in the interior. Aversion to cold and fever, absence of perspiration, coughing and wheezing with profuse, clear, watery sputum, a stifling sensation in the chest, heaviness and pain of the body, edema of the face and limbs, a white, slippery tongue coating, and a superficial pulse. So what's the history of this formula? Both Scheid and his team in Chen both agree the source of this formula is the first existing book on Chinese herbal formulas, the Shanghanlong Discussion of Cold-Induced Disorders by Zhongzhong Qing, written in 220 CE. So that is, like I said, the first book on formulas. If a formula is in that book, it's amongst the oldest formulas in the Chinese history. So this is an old formula, an older formula for sure. And that's the history of this formula. And what's interesting, usually when it comes to Shanghanlong, they both will agree, but with other formulas later on, often Scheid and Chen will disagree as to the source of the book. And I always love it when that happens, because then we have to explore it. So let's talk about the ingredients of Xiao Long Tang. And we have some issues with these as we're going to go through as we talk about them. So in a general statement about the ingredients, the efficacy of this formula is attributed to its ability to simultaneously release wind cold from the exterior and transform thin mucus in the interior. If the exterior is not resolved, the fluids cannot be moved. If thin mucus constrains the interior, protective yang cannot penetrate to the exterior. Only a strategy that focuses on both dispersing the protective yang and transforming the yin excess can overcome this vicious circle. So that's where the ingredients will come into play. So that's sort of setting up all the ingredients. And the first ingredient we have is a very problematic ingredient. We'll talk about that in just a second. So the first ingredient is ephedra herba or ma huang. And in this case, we want to use 9 grams. It's in the category of warm, acrid herbs that release the exterior. It induces sweating and releases the exterior, disseminates and facilitates the lung qi, calms wheezing and stops coughing, promotes urination and reduces edema, warms and disperses cold pathogens. One of the chief herbs, ephedra herba ma huang, releases the exterior, arrests wheezing, and promotes urination, according to Scheid and his team. Chen say ma huang herba ephedra also smooths lung qi flow to relieve cough, dyspnea, or trouble breathing, and wheezing. So it's a very important herb. It's one of the 2 chief herbs in this formula. The problem is it's banned in most developed nations. In the United States, you cannot import it. It's not in any prepared medicines. Can you get your hands on it any day of the week? I mean, I can go into, I think, any herbal shop in San Diego, and we have quite a few, and ask for ma huang, and more often than not, they'll just give it to me. And if they give sometimes they'll be a little bit hesitant, like, it's okay, I'm an herbalist, and they'll be fine with it. And so, or I speak a little Chinese and they're good, a little bad Chinese, they're good. And I've never not been able to get ma huang since it's been banned. But I would still be very cautious about giving it to my patients for medical legal reasons. If something went wrong, there's no defense. I mean, it's illegal. I'm screwed. I'll probably lose my license in that case. So actually, if I know how our state board works, they would suspend my license until I had further training and then let me come back into play. But still, I don't want that on my record anyways. So ma huang is a very difficult herb to get it's not difficult to get hands on, but it's a difficult herb to prescribe for patients. Unfortunately, there's no equivalent herb in Chinese medicine. And the one that I usually say has some aspects of ma huang, but not all of them, is xi, which is in this formula as well. So that doesn't really help us to replace ma huang in this formula. There just isn't a good substitute for this. So unfortunately, it limits the usefulness of this formula in developed countries at this point. Still important for us to look at. The formula is still important for us to look at, even if it's more difficult for us to actually use in everyday practice, unfortunately. And I mean, this comes up a lot, and I wish I had some suggestions for it, but I've asked master herbalists, I've done a lot of research. Is there anything you can do to replace ma huang? And inevitably everyone says no. It is singularly it's one of the few herbs that it's the only thing that does what it does. I often say herbalism is about substitution. You're either out of it or you can't get it, or the transportation. So it's like, what else can you use? And that's, to me, a really good herbalist knows those things off the top of their head. And most herbs you can substitute other herbs for, another herb or two to substitute for one herb. Can't do that for ma huang, as far as I've been able to figure out. So unfortunately, that's an issue on this herbal formula. The next herb in this formula is Cinnamomum ramulus guizhi, which is also in the warm acrid herbs that release the exterior. A lot of the herbs here are going to be in that form, in that category. It releases the exterior and assists the yang, warms and unblocks the channels and collaterals, warms the yang and transforms thin mucus, assists the heart yang and unblocks the yang qi of the chest, warms the channels, vessels, and collaterals, and warms the middle and directs turbid yin downward. The other chief ingredient, Cinnamomum ramulus guizhi, also combines three interrelated functions. It releases the exterior, opens the blood vessels, and promotes qi transformation. Together, the two herbs, they're talking ma huang and guizhi, the two herbs disperse wind cold from the exterior, promote water metabolism to remove thin mucus, disseminate lung qi, and open the vessels to treat wheezing and body aches. That's all according to Xiao and his team. Chen say, ma huang herba ephedra and guizhi ramulus cinnamomum, the chief herbs, dispel exterior wind cold factor through diaphoresis or sweating. Guizhi ramulus cinnamomum warms the yang and eliminates cold. Very important herb, cinnamon twig, very important herb and very useful in this formula. Our third herb is Zingiberis rhizoma ganjiang, or dried ginger. Here we want to use 9 grams, or in decoction 3 to 6 grams. Warm acrid herb, and it's also in the warm acrid herbs that release the exterior category. Warms the subcategory technically. It warms the middle and expels cold, rescues devastated yang and expels interior cold, and warms the lungs and transforms thin mucus. So we now have 3 herbs that are in the warm acrid herbs that release the exterior. This is a very warming formula, so keep that in mind when using this formula. We're going to see that in the cautions coming up. The deputies, Zingiberis rhizoma ganjiang and Asari herba xixin, which we're going to talk about in just a minute, warm the interior, transform thin mucus, and help the chief herbs release the exterior. Zingiberis rhizoma ganjiang is particularly effective in warming the spleen, the deficiency of which is the primary cause of the thin mucus. This is all according to Xiao and his team. Chen say, Ganjiang Rhizoma gingivalis enters the Yangming channel to warm the yang of the middle jiao to dispel cold. That's a lot of technical jargon in there. Remember, the middle jiao is the middle burner. We've talked about the 3 burners in previous episodes, but it's very useful for the middle burner, which is generally about digestion. Our 4th herb is a sari herb, or a xixin. Here we're also using 9 grams is what it says to use in shide, and then 3 to 6 grams are used in decoction. Warm acrid herbs, it's also in the warm acrid herbs that release the exterior, so very warming formula. It disperses cold and releases the exterior, dispels wind, disperses cold and relieves pain, warms the lungs and transforms thin mucus, and it unblocks and facilitates the orifices. The Asari radix et rhizoma at xixin also stops the coughing by facilitating the flow of qi throughout the body, according to Shide and his team. And Chen say, xixin radix et rhizoma rasari, acrid and hot, enters the Xiaoyan channel and warms the lung to resolve phlegm accumulation. It also assists Ma Huang, herba ephedra, and Gui Zhi, Ramulus cinnamomum, in releasing the exterior. So that's all according to Chen. Our 5th herb is Shishandra fructus or Wu Weidza, and again we're using 9 grams or 3 to 6 grams in decoction, and it's in the herbs that stabilize and bind. So this is the herb that kind of helps, mitigate some of all that warm acrid that we have from the other herbs so far. So it contains the leakage, traditionally the herb individually contains the leakage of lung qi and stops coughs, tonifies the kidneys, binds up the essence and stops diarrhea, inhibits sweating and generates fluids, quiets the spirit while calming and containing the heart qi. Employing only warm acrid herbs whose function is to scatter and dry might easily injure the qi and fluids and adversely affect lung function. For this reason, the assistant herbs Shishandra fructus Wu Weidza, which prevents the leakage of lung qi, and Paeonia radix alba or Bai Xiao, white peony, which nourishes the blood and nutritive qi, are added to the formula, and that's from Shide as well. Chen say, if only acrid and warm herbs are used in this syndrome, however, the lung qi may become dispersed or lost, and yin may be injured. For this reason, Wu Weidza, fructus Shishandra chinensis, is added to contain and prevent the leakage of lung qi. Our next herb is that that other pair with Wu Weidza, which is Paeonia radix alba or Bai Xiao. Again, 9 grams, either in decoction or just, so the way it works is you can powder it, you can decoct it, but 9 grams is the dose, either way in this case. And this is from the category of herbs that tonify the blood. Traditionally, it nourishes the blood, regulates menses, calms and curbs liver yang, preserves yin, adjusts the nutritive and protective levels, and alleviates pain. Bai Xiao radix Paeonia alba nourishes yin, tonifies the blood, and prevents the acrid herbs from drying up body fluids. Both Wu Weidza, fructus Shishandra chinensis, and Bai Xiao radix Paeonia alba are used only in small doses, as large doses may interfere with the exterior releasing effect. Our next herb is Pinellia rhizoma preparatum, or Zhi Sha. Again, 9 grams are used here, and this is in the category of warm herbs that transform cold phlegm. So now we're actually working with the phlegm, though Ma Huang can do wonders with phlegm as well. Traditionally, this dries dampness and transforms phlegm, causes rebellious qi to descend, directs rebellious qi downward and stops vomiting, and dissipates nodules and reduces clumps. Pinellia rhizoma preparatum Zhi Sha, another assistant, transforms thin mucus and harmonizes the stomach, according to Shide and his team. And Chen say, Ban Sha rhizoma Pinellia eliminates phlegm, directs stomach qi downward, and harmonizes the middle jiao. So again, we're trying to that digestive area, which is so important to qi development. And we're trying to make sure that's nice and strong. And I believe our last herb is Glycericerae radix preparata, or zhigansao. This is honey fried licorice. Again, it's 9 grams in general, 6 grams in decoction, and it comes from the category of herbs that tonify the qi. Traditionally, this herb is prepared with honey, which significantly increases its ability to tonify the middle, augment the heart and spleen qi, and harmonize the properties of other herbs, according to Bensky, which is one of our main single herb texts. The envoy, now according to Xiao, the envoy, Glycericerae radix preparata, zhigansao, augments the qi and harmonizes the interaction of the acrid and sour herbs. And according to Chen, zhigansao radix et rhizoma Glycericerae preparatum comel supplements qi and harmonizes the exterior releasing and astringent herbs in this formula. So really, it's harmonizing, and that's what often zhigansao is used for. So those are all of our ingredients today. Let's talk a little bit about preparation. So Xiao discusses preparation of Xiao, Qing, Long, Tang decoction. It's just a decoction, period. So decoction should be taken hot. At present, the dosage of Zingiberis rhizoma ganjiang and Asari herba xixin is reduced to 3 grams because of their extremely hot natures. Chen and Chen say the source text instructions are to cook Ma Huang herba fedra with 10 cups or 2,000 milliliters of water until the liquid is reduced to 8 cups or 1,600 milliliters. Take 1 cup or 200 milliliters of the warm strained decoction. Today, the decoction may be prepared using the doses suggested in brackets. Oh, I'm sorry, I totally skipped a line here. So when it's reduced to 8 cups, remove the foam from the top, add the other ingredients, and cook until the liquid is reduced to 3 cups or 600 milliliters, and then take 1 cup of the warm strained decoction 2 to 3 times a day, really, is what you're supposed to do there. Okay. Commentary. Xiao and his team, as usual, have an excellent commentary on this formula. This formula is basically a combination of 2 formulas that release the exterior, a fedra decoction or Ma Huang Tang, and cinnamon twig decoction, Guizhi Tang, together with poria, licorice, shishandra, ginger, and asarum decoction, or Lingan Wu Wei Jiang Xin Tang. It acts to warm the interior and transform thin mucus, and is most often used for acute attacks of wind cold in cases with chronic thin mucus. And then under a heading water metabolism, it continues. However, Essentials from the Golden Cabinet, Jingui Yao Wei, circa 200, explicitly uses this formula for problems of water metabolism that are not associated with exterior disorders. So let's talk a little bit about this for a second before we move on. So we talked about the Shanghun, which was written by Zhang Jing in 220. Actually, when that was written, it was one entire book, and it got split into 2 books. One was the Shanghun, and the other one is this book, the Jingui Yao Wei, the Essentials from the Golden Cabinet. So initially, they were the same book by the same author. One, the Shanghun is to deal with exterior conditions, and the Jingui Yao Wei is technically called miscellaneous diseases, which we would today probably call internal medicine. And so it was used both externally and internally is the idea here, by the same author in the same book that was later split apart. So there you go. So continuing with water metabolism. So we said previously, metabolisms that are not associated with exterior disorders. These include seeping thin mucus, yi yin, coughing with rebellious qi that makes it impossible for the patient to lie down, and vomiting of frothy saliva during pregnancy. The efficacy of the formulas in these cases is due to its ability to remove constraints to qi circulation that impede the transformation and elimination of fluids. Sometimes the image of a teapot is used to illustrate this function. In order for tea to pour from its spout, a teapot needs a second hole in the lid that allows air in as liquid flows out. Minor Bluegreen Dragon Decoction opens both holes, the pores in the skin and the urinary passageways, when they have become blocked due to either external wind cold or insufficient penetration of yang qi from the gate of vitality to the body's surface. This formula is thus an early example of the importance attached to regulating the qi mechanism in treating disorders of water metabolism. Here, this is partly achieved by regulating the ascending and descending aspects of the qi dynamic, primarily through the synergism between Cinnamomum granulus guizhi, which lifts generally, and Penilea rhizoma bansha, which mostly goes down. The latter herb, focused on the stomach, eliminates water and dampness both by drying and dispersing and through its ability to direct qi downward. The former herb, on the other hand, facilitates the ascending of qi and transformation of fluids via the liver, as discussed by Tang Zhanghai in discussion of blood patterns. And this is a quote from that. Cinnamomum granulus guizhi is a liver herb that transforms water. The liver is the child of the kidneys. When in a state of excess, the child drains the mother. Furthermore, the liver also governs dredging and draining, and thus has the ability to transform water. This herb also tonifies the heart. In case of deficiency, one tonifies the mother. The liver is the mother of heart fire. Furthermore, Cinnamomum granulus guizhi is red and enters the heart directly. To promote sweating, one can therefore also use Cinnamomum granulus guizhi. In this case, one borrows the warmth of wood qi in order to disperse and facilitate dissemination toward the exterior. It's an interesting commentary. Just as important is the formula's focus on ensuring unhindered entering and exiting. This is why acrid, warm herbs that promote exiting are combined with sour, astringent herbs that facilitate holding and entering. Paeonia radix alba by Xiao and Schisandra fructus wuweiza thereby contribute actively to the effect of the formula rather than merely counteracting the potential side effects of the main herbs. There you go. So that's its discussion of water metabolism. Scheid has another heading here under their commentary called key indicators. In summary, this is one formula that should be considered for any condition characterized by an excess of water that cannot be transformed by the body's yang qi, and that in turn constrains the qi dynamic. In clinical practice, this will most often involve conditions characterized by coughing and wheezing, although it may extend to other symptoms of water excess such as nausea, diarrhea, or edema. However, given the harsh nature of this formula, it is important to be certain that its use is, in fact, indicated in a particular case. Paying attention to the following 4 indicators will greatly assist in making the correct diagnosis. 1. Complexion. Cold, thin mucus obstructing the dispersion of yang to the exterior is often reflected in some degree of puffiness, especially around the eyes, but also the occurrence of dark spots indicating constraint due to cold at the temples, under the eyes, on the cheeks, or at the neck. 2. Pulse. Textbooks describe the typical pulse accompanying this pattern as wiry, indicating constraint due to thin mucus, or floating and tight, indicating cold fettering the exterior. In practice, however, the pulse can also be deep and slow, or frail at the distal or proximal positions, indicating that the yang qi cannot penetrate to the exterior because it is constrained by yin fluids. 3. Tongue. The typical tongue in this pattern will be wet with a slippery white coating. The tongue body itself will not be abnormal, unlike patterns marked by dampness due to kidney or spleen deficiency. And finally, 4. Secretions. Visible mucus in this pattern will be thin, watery, and bubbly. Sputum expectorated from the lungs will resemble egg white in consistency and be clear and transparent. Furthermore, once the acute symptoms have abated, it is advisable to switch to a milder formula, like those built around the combination of Cinnamomum granulus guizhi and Poria fuling, in order to promote the transformation of qi and water. Continuing with commentary, Chen say, Xiao Long Tang is frequently used today to treat wind cold invasion with interior water retention, a condition that usually occurs in individuals who live in colder climates or who are constitutionally more cold or damp in nature. It has extremely strong dispersing and warming effects. Thus, accurate diagnosis is necessary before prescribing this formula. Chief diagnostic signs for selecting this formula include profuse, clear, or white nasal discharge or sputum with aversion to cold, absence of sweating, dyspnea or trouble breathing, or cough with a white tongue coating. There should be no signs and symptoms of heat. This is a very warming formula, no heat. Continuing, moreover, it should not be used for a prolonged period of time, since the warm herbs may change the condition from cold to heat. Patients should also be monitored closely, as exterior wind cold condition can turn into wind heat condition rather quickly. As soon as signs of heat are evident, immediately stop the use of the formula and select a more appropriate formula. Other uses of this formula today include respiratory symptoms of sneezing, clear or white nasal discharge in those who are exposed to cold environments, such as with water sports, swimming, or outdoor activities in winter, skiing. The sudden or prolonged exposure to cold weather may give rise to aversion to cold and fever when cold, with sneezing and profuse nasal discharge, water retention. The use of Xiao Long Tang in this situation is extremely effective and offers immediate relief so that the condition does not progress inward. Xiao Long Tang, however, is not designed for long-term use. Building the immune system by using a formula such as Yunping Fang San or Jade Windscreen Powder to strengthen the Wei defensive qi is crucial to preventing exterior pathogenic attacks. So basically what they're saying is after using this formula, you need to support the defensive qi. All right, let's talk some modifications of this formula. Scheid and their team discussed 3 modifications for this formula. For severe exterior cold disorders, increase the dosage of ephedra herba mahuang and Cinnamomi ramulus guizhi. For marked congestion, copious sputum, breathing difficulty while lying down, a slippery and wet tongue coating, and a wiry and tight or wiry and slippery pulse, increase the dosage of Asari herba xixin and Pinellia rhizoma preparatum zhiban sha, and add Zingiberis rhizoma recens shenjiang or fresh ginger. So you're adding in fresh ginger. You're going to have fresh and dry ginger in this formula. And their third modification for pronounced nasal congestion, runny nose, and headache, substitute Zingiberis rhizoma recens shenjiang for Zingiberis rhizoma ganjiang. So now you're switching them. Substitute Peony radix rubra, Qirsha, that's red peony, for Peony radix alba, Baisha, or white peony. So you're switching those out. And add Sapassionicovia radix feng feng and Schizonipidae herba jingje. I think we've had both of those on our spurs herbs at this point too. Shen Chen has many modifications of Qing Long Tang. So with cough and dyspnea, add Cushing Ren or Semen Arminaceae amarum, that is apricot seed, and whole po, Cortex magnolia officinalis. With fever and sore throat, add Jade Gong, Radix platyconis, platycodonis, and Xiao gypsum fibrosum. With irritability arising from heat, add Xiao or gypsum fibrosum. With thirst as a result of lung heat, add Xiao, gypsum fibrosum, and Huangqin, Radix scutularia. So this is interesting. These last two, they're saying, we've said all along, don't use this with heat, but now they're adding Xiao is very cold, and Huangqin is very cooling as well, cooling cold. So what we're kind of doing is counteracting the hot nature of this formula, still being able to use it in a heat condition. Their next modification is with absence of sweating and severe aversion to cold, increase the dose of mahuang, herba, ephedra, and guizhi ramulus Cinnamomi, which is very similar to what Scheid said. With sweating and severe aversion to cold, increase the dose of guizhi ramulus Cinnamomi and Baisha radix peony alba, and add Shenjiang rhizoma zingiberis recens, that's the fresh ginger, and Dazhao fructus jujube, that's Chinese dates. If the exterior symptoms are not severe, remove Guizhi ramulus in a moment and use honey-fried ma huang herba ephedra instead. So again, it's hard to get ma huang. It's probably even harder to get honey-fried ma huang. So there you go. So comparisons of this formula with other formulas, which is going to be very useful because, again, with the ma huang, it's going to be difficult to use this formula. So Xiao et al. Compare this formula with 5 other formulas, so we'll cover only 4 here. The other one was like, they were comparing 3 or 4, and it didn't really clearly define exactly, so I skipped it. So 4 of them are here. So the first one is 5-ingredient powder with poria or wuling san. Both formulas treat accumulation of water excess in the interior with cold in the exterior. However, this formula focuses on the upper burner, chest and lungs, and is used primarily for patterns characterized by wheezing. Secondary symptoms are an absence of sweating and no thirst. 5-ingredient powder with poria wuling san, on the other hand, focuses on the lower burner and the bladder and is used primarily for patterns characterized by inhibited urination. Both thirst and sweating are important secondary symptoms. Compared to ephedra, apricot, kernel, gypsum, and licorice decoction, or ma xing shigan tang, both formulas treat wheezing and coughing with sputum that may be white in color. However, a minor blue-green dragon decoction, xiǎo qing long tāng, presentation is characterized by aversion to cold, while an ephedra, apricot, kernel, gypsum, and licorice decoction, ma xing shigan tang, presentation is defined by the presence of heat. There you go. So one's heat, one's cold. Their formula is perilla fruit decoction for directing qi downward, suzi jiang qi tang. While both formulas are used for coughing and wheezing associated with cold and congested fluids, perilla fruit decoction for directing qi downward, suzi jiang qi tang, is indicated specifically for a condition of excess above and deficiency below. While minor blue-green dragon decoction, xiǎo qing long tang, is indicated for externally contracted when cold in patients with chronic spleen deficiency and congested fluids. And our fourth comparison is with arrest wheezing decoction, or ding chuan tang. Both formulas treat patterns characterized by wheezing, complicated by the presence of cold in the exterior. Minor blue-green dragon decoction, xiǎo qing long tang, however, focuses on patterns with cold and thin fluids in the interior, manifesting with a white tongue coating or a wet tongue and a floating tight pulse. Arrest wheezing decoction, ding chuan tang, on the other hand, treats patterns with phlegm heat in the interior, manifesting with a yellow tongue coating and a rapid pulse. So again, we're looking at more of a hot condition versus more of a cold condition. So that's it for Xiao's comparison, but Chen discusses comparisons with 2 other formulas. And here we go. Ma huang tang, ephedra decoction, and xiǎo qing long tang both treat cough, but have the following differences. Ma huang tang treats exterior excess when cold condition. Its chief function is to induce perspiration to expel pathogenic factors. It is not designed to treat asthma or to relieve cough. The dyspnea, cough, or wheezing are secondary symptoms of wind cold attacking the lung, giving rise to respiratory difficulties. Xiǎo qing long tang treats exterior wind cold attack with interior water accumulation. It has dual functions to release exterior wind cold and resolve interior water accumulation. Its main function is to warm the lung to resolve water accumulation. Therefore, along with cough, dyspnea, and wheezing, there are additional key symptoms such as profuse clear sputum that may be frothy, as well as clear or white nasal discharge. Da qing long tang, or major blue-green dragon decoction, and xiǎo qing long tang both release the exterior and arrest wheezing to treat exterior excess conditions characterized by dyspnea and the absence of perspiration. Both formulas treat exterior and interior excess and contain ma huang herba ephedra and Guizhi ramulus cinnamomum. Their differences are as follows. Da qing long tang is based on ma huang tang ephedra decoction, but the dose of Ma Huang herba ephedra is double that of the dose in Ma Huang Tang ephedra decoction. Moreover, it contains xiǎo, gypsum fibrosum, to clear lung heat. It is most suitable for exterior access wind-cold condition with interior lung heat. Other key signs include heat sensations, irritability, and the absence of perspiration. So if Da Qing, so major, it can actually treat heat conditions. Xiao Qing Long Tang is also based on Ma Huang Tang ephedra decoction, but it omits Qing Ren, Simonoma armanaceae amarum, and adds Xixin, radix out Rhizoma acari, Ganjiang, Rhizoma gingivaris, Uwedza, Fructus Hischandra chinensis, Ban Sha, Rhizoma pinealia, and Bai Xiao, Radix peoni alba. The dose of Ma Huang herba ephedra is low because wheezing and dyspnea are not the primary symptoms of this formula. Rather, the key symptoms are coughing with profuse, clear, white sputum and nasal discharge. Xiao Qing Long Tang is most suitable for exterior excess wind cold with interior cold phlegm in accumulation. So it's cold all around. What are some biomedical indications of this formula? So Chen say this formula has many clinical applications: anti-asthmatic, anti-allergic, antiviral, immunomodulatory, so it helps the immune system, increase adrenocortical hormones, and sympathomimetic. So in other words, it activates the sympathetic nervous system, or acts like an activation of the sympathetic nervous system. Scheid et al. Say, with the appropriate presentation, this formula may be used to treat a wide variety of biomedically defined disorders. These can be divided into the following groups: disorders marked by coughing and or wheezing, including upper respiratory tract infections, acute and chronic bronchitis, bronchial asthma, emphysema, cardiopulmonary disease. Disorders marked by discharges from the nose and or eyes, including hay fever, allergic rhinitis, viral conjunctivitis, and dacryosolenitis. I had never heard this term before. I had to look it up, but it's simple. It's an inflammation of the lacrimal gland or the tear gland. So, disorders marked by hiccups or retching, including enteritis, peptic ulcer, atrophic gastritis, cirrhosis, chronic bacillary dysentery. So that's dysentery by bacillary bacteria. Miscellaneous diseases such as nephritis or kidney inflammation, rheumatic heart disease, pleuritis or inflammation of the lung pleura, epilepsy, enuresis or bedwetting, and periarthritis of the shoulder, so inflation of the shoulder joint. So that is our biomedical indications. What about science behind this? So Chen lists several clinical studies with positive findings involving this formula, including pulmonary disorders with cough and wheezing with 258 patients, with 120 with acute pneumonia, 58 chronic pneumonia, 60 acute asthma, 4 with pulmonary emphysema, 4 pleurisy, 1 tuberculosis, 1 pulmonary carcinoma. So right here, 250 patients. I always say look at the n number to see if it's powered enough, and we're looking for a minimum of 30 to 40 patients. It's well above that minimum, but this was way too many different conditions. It's just I can just tell, even not having read it, it's a poorly designed study. So kind of keep that in mind. A modified version of this formula was studied for treating bronchitis in 51 patients, and another study looked at bronchitis in 65 children. So still small, but over that 30 to 40 hump. Another study looked at a modified version in 89 pneumonia patients. 2 studies with n equals 30, the number of patients 30 and 39. So these are probably not statistically valid. Look at bronchial asthma, both acute and chronic. A modified version was used to treat cough in 60 patients. And 53 patients were in a study looking at rhinitis, and 386 patients with allergic rhinitis were treated with modified version. So there you go. So that's the only formula here that the only study here that might be interesting is this last one with 386 allergic rhinitis. Other than that, these all are relatively small. Maybe the pneumonia patient one as well. Relatively small, but at least pointing in the same direction. A literature search found 1 systematic review looking at the use of Xiao Qing Long Tang for allergic rhinitis. They concluded, our results indicated that oral XQLT or Xiao Qing Long Tang may alleviate the TNSS or total nasal symptom scores rhinorrhea scores, and nasal obstruction scores of AR allergic rhinitis, and is safe to use in clinical practice. However, more randomly controlled trials that follow rigorous methodologies and evaluate well-accepted outcome measures are required to evaluate the effectiveness of Xiao Qing Long Tang. So in other words, it's a fairly positive conclusion, but there's more work to be done. There are some potential drug-herb interactions for this formula. A few herbs in this formula may present some risk for drug-herb interactions. There are 3 that may have some cytochrome P450 interactions, which is one of our 4 major areas that we look at for risk factors for drug-herb interactions. Glycerin radix gancel may induce cytochrome P450 2C19 and 3A4. We're particularly worried about 3A4. 2C19 is like the 3rd or 4th most commonly used cytochrome P450. We're not going to get into all that right now, but so 3A4 is a big issue. Zingiberis rhizoma ganjiang may inhibit 2C19, and Schisandra fructus wuweiza appears to strongly inhibit 3A4. So we have some definite 3A4 interactions here. Additionally, Schisandra fructus wuweiza may also inhibit P glycoprotein. Case was reported of congestive heart failure and hypokalemia or too little potassium in a patient taking gancel. That's licorice, furosemide, and digoxin. So shouldn't be using all 3 of those together. Gancel may increase blood pressure and fluid retention when used with oral contraceptives, as shown in 2 case studies and an uncontrolled human study. That's C-level evidence. Evidence goes from A to D, D being the worst, so C is the step above the worst. At least there's some clinical indication. An extract of ginger was speculatively enhance anticoagulation of warfarin and other anticoagulants. The common name for anticoagulants is blood thinners. I don't like that term, but that's the term most know. 10 grams of extract did affect platelet aggregation, while taking 4 grams daily for 3 months did not show significant anticoagulation activity. So in other words, if you use it in moderation, it's probably okay. And I think we'd be using that in moderation in this case. A large epidemiological study, N equals 1,795, that's a big study, showed increased adverse effects in patients taking Chaihu, Zhirza, Wuweiza is the one we're worried about here, Shu or Shengdi, Wang, Mutang, and Cheqianza with clozapine, quetiapine, or olanzapine. So I don't think we need to have, Wuweiza might be a concern there. The hypertensive effects of ephedrine were blocked when Ma Huang was used with amitriptyline in 1 human case report, despite the possibility of hypertension and arrhythmias speculatively thought to occur with sympathomimetics, which Ma Huang is, and tricyclic antidepressants are combined. Okay. Based on ephedrine content, Ma Huang may cause hypertension with monoamine oxidase inhibitors, MAOIs, which are antidepressants, and also different type are used for Parkinson's. 1 case report, I'm just not going to go over this. Let's just say that in general, that there may be some issues with the MAOIs and Ma Huang. Concerns. Scheid and his team has some cautions and contraindications for Xiao Qing Long Tang. This formula should not be used long term, nor for conditions with heat, coughing of blood, or coughing due to yin deficiency. Used with caution in cases with hypertension. In such cases, prepare ephedra herba or Zhirmang Ma Huang is often substituted for ephedra herba Ma Huang. Chen Chen say Xiao Qing Long Tang should not be taken for a prolonged period of time. It should be discontinued when the desired effects have been achieved. This formula is contraindicated in the following situations: heat condition with a sore throat or a rapid pulse, wind heat or beginning stages of when being warm disease, yin deficiency with dry cough or thirst, phlegm heat conditions with thick yellow sputum, cough with streaks of blood in the sputum, and cough with thick yellow sputum, thirst, a red tongue with yellow tongue coating, and a rapid pulse. Because this is a relatively strong formula, caution must be used when prescribing this formula. Shishin radix rhizoma isari must be prescribed carefully because it is potentially toxic at a high dose. Uwedza fructischandra chinensis must not be used at a large dose to avoid retaining the pathogenic factors inside the body with its astringent effect. Use of Xiao Qing Tang has been associated with only a few side effects, such as dry mouth, sedation, and drowsiness, due mainly to the blockage of histamine H1 and muscarinic receptors in the salivary glands and the brain. Use of Xiao Qing Tang has been associated with rare cases of gastrointestinal discomfort, nausea, vomiting, and diarrhea, and skin itching. These reactions were self-limiting and resolved upon the discontinuation of the formula. So that was today's formula, Xiao Qing Tang, or Minor Bluegreen Dragon Decoction, a useful and strong formula for treating colds with copious sputum. A combination of ephedra decoction, ma wang tang, and cinnamon twig decoction, huizhi tang. Since it is so strong, there are several important cautions and contraindications. All in all, this was another scintillating deep exploration into the deep seas of Chinese formulas. In 2 weeks, we're going to be looking at another single Chinese herb, xinyi, magnolia floss, or magnolia flower. This herb is in the Chinese medical subcategory of warm acrid herbs that release the exterior, under the category of release the exterior herbs. It is helpful for certain types of colds and helps nasal conditions. And as always, we will look at something a little different. Join us in 2 weeks for another interesting episode. I'd like to thank you very much. If you like this podcast, please do us a huge favor. Subscribe to our podcast in your favorite podcast app, or give us 5 stars. Either one, we would love and we appreciate. And thank you for even thinking about it. And don't forget our amazing continuing education deal at www.integrativeMedicineCouncil.org/CEUS1. You can always get in touch with me at Dr. Greg at spurbsherbs.com. That's SPERBSHERBS.com, or at our website, www.spurbsherbs.com. And as usual, we have our extensive bibliography. Thank you very much.